and this is how it's going to look. As you see, the light is really strongly shining. Hello, I'm at that age that I'm asking myself every day, am I doing enough to keep my heart in very good shape? Because so many people now have some sort of heart problems, and I want to make sure that I'm doing what I can to keep myself healthy and well. And apart from, of course, a good healthy diet and some exercises every week, I thought I should also supplement myself with doing some sort of red light therapy for my heart. And in this video I'm going to show you how I do it, and perhaps you will consider doing it as well. Of course, after you consult your doctor or other specialist. Before I actually demonstrate how I use this light for light therapy on my heart, perhaps I should say why I'm doing it, because there is not much of scientific research showing that doing light therapy on our heart area can actually do any benefits for our heart. So let me tell you what I think about it, and you will make up your mind. First, let's state the facts. Heart is a muscle, arguably the most important one for our life. And red light therapy, which is another fact, has been extensively used for many years to improve muscle performance and recovery. Of course, most of the time we know research about our regular muscles improvements, so on muscles on our hands or our legs, in any other part of the body. There were not much research about improving our heart muscle. But definitely red light therapy is well known and well researched about the benefits of improving our muscle health, performance, and also recovery. Another well-known benefit from red light therapy is improving blood circulation and also anti-inflammatory action. So if we combine all these facts together, that heart is a muscle and red light therapy helps improve the muscle performance and also heal the muscle if it's injured, then perhaps we should consider using it to actually do something to help our heart be better. And I think we can benefit from red light therapy on our heart in two ways. First, as a preventative measure, so just do it to make sure that our heart is in tip-top condition, like we do for our other muscles, especially when we are sport people. But also we can possibly use it after there is some problem in our heart muscle, and together with our doctors, perhaps we can supplement the conventional method of helping our heart recover after some sort of health problem with using red light therapy as well. So first of all, of course, remember, I'm not a doctor, this is not medical advice, and this is not medical equipment. So whatever I'm showing you here is just for educational purposes only, and I'm showing you how I use red light therapy for my wellness and well-being. And if you decide to do it the same way, you always do it first after consulting the relevant specialist, and second, you do it at your own risk. So when we now establish that red light therapy potentially can help our heart be better because it's a muscle, then how would we go about this, and what sort of equipment we need for this? And I think this kind of small therapy light, it's probably ideal for this solution, because first of all, it's quite affordable. Second of all, it's small, so it will just do the light therapy for this area which we need. And it offers the wavelengths of light we need to actually penetrate deep into our muscles, especially when we want to reach the heart muscle. So this kind of light panel usually has at least two types of wavelengths of light: red light, something about 660 nanometer, and near infrared light, something about 850 nanometers. And for heart specifically, we want to use near infrared light because we want to penetrate deeper into our muscles, into our body. And actually, the ideal wavelength for reaching the deepest into our body is 810 nanometers. So some panels offer this wavelength of light, some not, so it depends what you have. So if you don't have the red light therapy panel yet, and if you want to use it for doing some light therapy on your heart, perhaps you want to find the panel that actually offers 810 nanometer wavelength. But of course, if you already have a panel and it's got 850 nanometers, just try to do whatever you have and see if you get benefits or not. And now let me just demonstrate how I use it. And of course, this is just for educational purposes. Okay, so first I set up my panel to use only near-infrared light because I want the strongest near-infrared light to penetrate deep into my chest area, and hopefully some of the light can even reach our heart. They say that near-infrared light can penetrate up to 2 inches deep into our body. So 2 inches, it's something like this. I think I'm not very muscular person, so perhaps I have good chances that this near-infrared light actually can reach my heart or around my heart to affect the heart muscles and also all the arteries and veins which support my heart, which is actually equally important, because when we consider that quite a lot of people have heart attack because of some sort of blood clots or some sort of problems with the blood circulation around our heart, and if you use red light therapy to improve the well-being of this area, so improve the blood circulation and all these muscles and veins, first maybe we can prevent ourselves from having any sort of heart problem, and second, and if we have any kind of heart problems brewing over there, perhaps we can support our heart muscle and all this area to actually rebuild it, rejuvenate, and help prevent any further problems. Okay, so let me show you what I use here. This panel is Mito ADAPT, and I use it for this specific purpose because it's got 11 light modes, and the mode 11 has got all 3 near-infrared wavelengths of light shining very strongly into our muscles and joints. That's why I use it. So I turn the light on. It's actually on already. So basically I change in the settings for near infrared. So I change the mode near infrared, which is the last one, mode 11. Because in mode 11 we use very strong near infrared light, just to be on the safe side, manufacturer limited the amount of time for the session using this 3 wavelengths to only 5 minutes. If we choose other wavelengths with red light, the other mixture of wavelengths they offer, because it's 11 modes of light, you can do session up to 20 minutes. But for this specific purpose, because it's very strong near infrared light, just to be on the safe side, they reduce it to 5 minutes. Probably because they want to make sure that we don't shine too strong light, near infrared light, on our eyes, because more than 5 minutes very intense near infrared light may be just too much for our eyes. So of course whenever we shine light near our eyes area, we always wear goggles, but they thought, just to be on the safe side, let's reduce it to 5 minutes. But because I'm doing it for my heart, I'm not going to look directly on the panel, because I'm going to put that panel actually like this. And by doing this, I'm not looking at the light, so I don't really need to wear the goggles. And because I'm going to do light therapy on this chest area, I'm going to do twice for 5 minutes, 2 times. So because the light will switch off after 5 minutes, I will turn on the timer, wait 5 minutes, do the session for 5 minutes and do another session after this one for 5 minutes. Because I want 10 minutes per area. I want the strong dose of light reaching my chest. Okay, so because I'm using near-infrared light, you won't see much. So at the moment, I'm going to do it just as I do it with near-infrared light, but later I will show you with red light so you can see how this light actually shines over the body. But of course, you always need to bear in mind that for deep tissue, we use near-infrared, not red. Okay, so basically, to do my session, I will just sit next to this table. Of course, I will first take off my clothes because I want the light to go through my skin and not just bounce off the clothes. And basically, just press the button and enjoy the session. And this is how it looks. I can even do like this if I feel too tired, or sometimes I'm just having my mobile phone here and just watching something or listening to music or maybe on some podcast if I want to spend this 10 minutes in a more productive way. But sometimes I just close my eyes and just relax, especially when you do it after a busy day of work. And that's basically it. And the light will automatically switch off after 5 minutes. So when I do another session, I will turn it on again. And then when I've done, 10 minutes is enough. According to most recommendations by many manufacturers, 10 minutes per area is just about right, especially when we're doing it here with very strong light, 3 wavelengths of near-infrared light, and also we do it quite close because I think I'm about between 2 and 3 inches away from my body with this panel, so it means the light is really going as strong as possible into my body. And now let me change for red light so I can demonstrate how it works. Okay, just basically the same. You just lean over, press the button, and this is how it's going to look. As you see, the light is really strongly shining on my chest, and this is the idea. So this is how I do light therapy for my heart. And of course, when the light penetrates hearts, it also helps with our lungs and all this area. So all these organs actually receive very beneficial near-infrared light, and hopefully they get some benefit from it. Remember, I'm not a doctor and this is not medical advice. I'm just showing you how I use red light therapy to prevent myself from having any heart problems. But because there is still no much research about actually does this light help the heart and improve its performance, probably we need to see more research about it. But considering that for modern research you need to have a lot of funding, and because researching red light therapy for heart problems, it's probably not going to be very profitable for companies who invest in this kind of research, because you cannot patent it some sort of new medication or new magic pill that will help. Then I'm not sure how soon we are actually going to see any relevant scientific research on this topic, unless some very generous millionaire will splash some cash to do this kind of research for pro bono. So I decided that I'm doing it for myself because I feel like that makes sense. I just basically connect the dots. Heart is a muscle. Red light therapy helps improving the muscle, reducing inflammation and improving blood circulation. For me, that's enough recommendation, like a common sense recommendation, that activity may help me and my heart be better off. But of course, you do what's best for you. Remember, this is not medical advice, and you always consult your relevant specialist first, because perhaps if you have some sort of electric device in your heart, maybe shining the light on it, it's not a good idea. Or maybe you have other problems that maybe contradict use red light therapy. And bear in mind that red light therapy devices like this are well-being devices, not medical devices. They are not designed to cure specific health problems. They are just designed to help us benefit from positive effect of red light therapy on our body. So with all your health problems, always refer to the relevant specialist before you start any kind of therapy. If you gain value from this video, please give it a thumb up. I really appreciate it. Share with your friends who'd also benefit from watching it. If you are interested in the panel I use, this is Mito ADAPT. I like it because it's got this 11 modes of light, and the mode 11 is actually 3 wavelengths of near-infrared light, which I use for doing light therapy on my heart and chest area. So if you are interested in this panel, check out my affiliate link down below. You will get 5% discount if you decide to purchase it, and I will receive a small commission, which is a win-win for everyone. Thank you very much for watching, and I hope to see you in the next video. Have a great day.